See, there are many factors that influence which specialty you will do and where you'll go in the field of medicine. Passion is not one of them. Passion is what drives you to come and do the course of medicine at undergraduate level. Now, when you finish undergraduate level, passion stops there. There are other factors that influence, like money, the money you want to make, or the money you're willing to invest in education. That's where scholarship comes in as well. Your age, and the stress factors that you're willing to handle, because different specialties stress you differently. There used to be the big four, pediatrics, internal medicine, OBGY, surgery, and that's what you know when you've just joined medical school. You want to be one of those things, but the deeper you're invested into the course, the more you discover the light and other things. Those are specials, what. Those things, you know them when you join there. Now, also it has to be noted that there are some specialties that choose you and some that you choose. So the moment you join medical school, there are things that choose you, like you can't just wake up in year 4 and you're like, I want to be a neurosurgeon. No, it is impossible. This one, it is seen from you. From the day you join medical school, your friends will start calling you neurosurgeon, cardiologist. Like also, if anatomy has never been your friend, you cannot just wake up one day and you do neurosurgery. Anatomy has to be like your friend, not a colleague, like your friend. Like when us were suffering with things like which nerve is this, which you're identifying the brachial plexus, you're tracing it to the roots, you're seeing all the nerve roots, like in your head. Those ones choose you. Surgery, anything to do with the brain and the heart, it chooses you, don't choose it. It is God's calling to be a neurosurgeon, a cardiologist. Like these are the guys who'll be waking up at 3 a.m. randomly to do things, like to read books. Like it's like, why? Now, when those two have been chosen, now as we start deciding now, my advice is simple. When you're choosing a specialty, it is important to choose something that doesn't involve handling a lot of men. Not because I hate men, but like men rarely get sick. And even when they get sick, for a man to be admitted to the hospital, he has to be unconscious, so that the decisions they made, it was when he was not aware. Because even when they wake up, they want to go. Like men don't want to be sick. And I'm not saying urology is a bad option, but you have to think in that line. Like, you know how both men and women get UTIs, but it's only women that treat their UTIs. For a man to come to you, doctor, and he has to be like peeing blood. He can't eat, like he can't eat. He has tried put. It has to be so serious. So like, of course, when you're deciding, you stay away from, like, leave us. Most people always go into obstetrics and gynecology because there's always a mother delivering somewhere. Like you'll always have clients if you're good at what you do. It's very simple like that. But you can't apply that same concept and you do pathology or forensics medicine. It's a very the two are different. And you use the same thing, things like dermatology, plastic surgery, like anything involving women, like clients will always be there. Yeah, remember, money is a very big determinant in these things. Passion stopped up the other side. Now, women and kids move hand in hand because pediatricians also have their own market. Like, no one wants to tamper with kids. No one wants to treat kids unless they are pediatrician. Like, you see how most medical officers can, you go, you're sick, you have this, they give you a steroid. You give you a steroid. No one wants to tamper with children. Once a kid comes in, even if they are vomiting, the best someone will tell you is, you go and see a pediatrician. That's another specialty that the market will always be there. And your clients are annoying, so no one wants to tamper with them. Like children are always crying. You put on a coat, they cry. You remove the coat, you put on scrubs, they cry. You come with a stethoscope, they cry. You remove the stethoscope, they cry. So like your clients are your clients. No one is going to come there. So if you position yourself and you're good at it, ready to go. Now, if you're introverted and you like reading a lot, then you'll go down the internal medicine path. These guys, they know a lot. They're the custodians of knowledge. They know it all. Like they read articles before they're even published. Like it's just, if you're with the one who was always discussing for your friends, these guys can discuss a concept to you from cellular level and you see it coming. You get it? So that's your choosing. You'll go to internal medicine. Very well and good. They do read a lot, know a lot of things, do very little for their patients, but they know a lot of things. So if you're impatient and for you just want to see things get done, that's when you go to surgery. These guys get things done. By how? It doesn't matter. What is that? It's a hernia, remove it. What did you say you have? You have a lump. How did it come? I don't know. You want it removed? Remove it. surgery is your calling. If you like cutting, seeing blood and getting things done, and then patients are like, thank you, Musa. Also, if you hate ward rounds, you go for surgery. It is that simple. Like they're always in theater removing something. Like the only time surgeons do ward rounds is to review their patients. Like, what I removed, does it come back or is it's gone? Okay, nice. Where's the next person to be cut? Like surgery is your calling if you want to see things get done. And also if your anatomy was okay, doesn't have to be so good. Like if you're not a people's person, you're probably going to do radiology, spend your entire day in dark rooms and seeing CTs, seeing ultrasound, and you say, oh, correlate clinically, and I like this one, it's interesting. Correlate clinically, like if you hate patients and the years in medical school were enough for you to see enough patients, you go down the radiology path. And these specialties are very many. Like I think it depends on the country you're in. In Africa, we're a bit limited because guys are wow, and surgeon. It's it. Some things here, the country also matters, but also don't do ophthalmology if you can't see, because your patient will come to you and like, doctor, I have a problem with my eyes. You're like, oh, me too. Like, well, what is that? If you can do 200 push-ups, you can bench press, you're always lifting weights, you're the one who was beating people, and then you got into medical school. The moment you finish like this, sign up for an orthopedics clinic or some center and start learning how to pull bones. Orthopedics is your calling if you like using a lot of energy. You'll use the brain too, but too much energy. Then if the title doctor alone impressed you and you see that undergraduate you achieved a lot by being a doctor and you want to earn from it but not practicing a lot, then my brother, go down the public health path, the global health path. Like it's very interesting to be that side. Like you'll be the one in conferences. They're like, oh, Dr. Derek, come and say something. You're like, oh, yeah, interesting. I'm very happy to be here. Hand washing is a very good technique, and I think we should all adopt it. Then everyone claps.